The cruise ship at the center of the Hantavirus outbreak will dock in the Canary Islands in Spain at some point on Sunday. Officials from the CDC are en route to meet the 17 Americans aboard and transfer them by plane to Nebraska, where they will quarantine for 6 weeks. World health officials are tracking the ship's path to contact trace for any possible new cases. So far, there are 5 confirmed cases connected to the cruise ship MV Hondius. There have also been 3 deaths. The virus is typically known to spread through contact with rodents, but it may have passed from human to human aboard the ship. That's according to the WHO. Now, here in the U.S., 6 states are monitoring people who came into contact with people exposed to the virus. While the COVID pandemic is fresh in people's minds and a disease that is unfamiliar can cause some anxiety, the WHO is seeking to calm those fears, saying, quote, "This is not the start of a COVID pandemic." So to help separate fact from fear, CBS News medical correspondent Céline Gounder is here to help us all navigate this. Dr. Gounder, thank you so much. I think you know well, when people hear any sort of virus now, they think of COVID, and that's where all the fear comes in and the questions. So let's start there. How is this virus different from COVID-19?
So this is not a viral respiratory infection. Hantavirus typically, and I will say typically, is transmitted through rodent urine, saliva, or droppings, and those get aerosolized. Maybe you're sweeping up in your shed or you're vacuuming, and that's how people normally get infected with a hantavirus. Andes virus is a little bit different. What we know about Andes virus is that it has been transmitted person to person, but it's still a lower respiratory tract infection when that happens. So in other words, it's in the lungs. And so you need to have very prolonged, close contact with somebody to be infected in that fashion. It's more like tuberculosis than it is like COVID or flu or measles. What we have seen with the biggest outbreak of Andes virus in Argentina, the people who were most likely to be infected were actually sexual partners. Not to say that this is sexually transmitted, but it's that very close, intimate contact, sleeping in the same bed, kissing, et cetera. Those are the people who are far more likely to get infected, even than just other household contacts. The really good news we got in the last day was that the flight attendant who was exposed on a flight to one of these hantavirus cruise ship passengers who was returning home on a plane, that flight attendant has tested negative. She was having some symptoms, was worried it was hantavirus. It is not hantavirus. Now, she will still need to continue to be monitored. A Spanish passenger from the same flight is also being tested. But if this same pattern holds, that supports that the virus requires prolonged, close contact to transmit.
So that's some of the descriptions of how contagious it is. How deadly is it? And then also, can you walk us through, we're hearing, 6 weeks quarantining for those who are landing in Spain. What's this quarantine like?
Yeah, so the case fatality rate is quite high for those who progress to severe hantavirus. It results in lung and heart failure. And when that happens, really the only way to save somebody is to use a heart-lung bypass machine, what we call ECMO. In terms of the 17 Americans who are being brought back, so the ship arrives in Tenerife, Spain on Sunday. The State Department is coordinating a repatriation flight with the CDC that will have biocontainment units on board. Nebraska Medical Center, the only federally funded quarantine unit in the country, is on standby, and they will be drawing upon their experience with the early COVID cruise ship quarantines. So far, the 17 Americans who left the ship earlier are being, the 7 Americans who left the ship earlier, who are back in the 5 states. None of them have symptoms. Behind the scenes, some things are moving, but publicly, unfortunately, Americans are really hearing nothing. No one from HHS or the CDC has briefed the public. No health alert has gone out to doctors telling them what to watch for. A CDC source told me that the response team was only authorized to start work on late on Wednesday, and the holdup appears to have been getting a waiver from HHS to cooperate and coordinate with the WHO. All CDC communications now have to go through these heavy filters at HHS, which is partly why the public hasn't heard much of anything yet. There are no pre-prepared quarantine protocols for hantavirus, so they're writing them as we speak. And monitoring is being handled state by state while the CDC finalizes those guidance.
Yeah, I mean, to that point, when I first started to hear about this, one of the questions I had was about all these cuts that we saw to the CDC last year. Does that have any impact on their work, how they can contact trace, for example? What kind of impact could you see?
Well, the impact is from the top all the way down. So you have who can speak to the American public and have authority and be trusted, have credibility in this situation. We don't have a CDC director. We don't some of the leading experts in infectious diseases and vaccines and emerging infectious diseases have been fired or left the CDC. You don't have a surgeon general. So who does that leave? Well, you have the State Department that's coordinating this response. So Marco Rubio, we have Secretary Kennedy. There's, I guess President Trump, but there's not a lot of leadership on the public health front. And then uh, I think one thing people don't realize is public health functions a lot like the military. It's very much about operations, logistics, the chain of command. And when that chain of command has been decimated from the top all the way down, that does create issues for coordination, for communication. The good news is that there are some very expert people on the ground, specialists in Nebraska, for example, at the quarantine unit. They are excellent, but you just need to have all the different pieces functioning together to coordinate a response like this.
We are very lucky to have your expertise, Dr. Gounder. Thanks for level setting with us and for our audience. We appreciate it.